Our session today is about post-traumatic growth, and it's going to be in two parts. One is going to be talking about transitions, the transition we all find ourselves in. And the second part is some of the growth aspects that we've seen where people have optimised the time they've had in the pandemic to forward some of their services and make some improvements. So just going to introduce ourselves before we go into the PowerPoint. My name's Jude Graham. I'm currently the Director for Psychological Professionals at Rotherham, Doncaster and South Humber, and I've been working in the pandemic both within Trust but also across region and nationally in terms of some of the health and wellbeing approach.
Hi, my name is Jules Lewis, end-of-life care facilitator at Shrewsbury and Telford Hospital, and obviously I've been out there helping and supporting staff during this pandemic, and we've been doing a lot of staff debriefs and staff bereavement support. So welcome, and also today I am hosting an event in the foyer here at Shropshire Education and Conference Centre. So very busy, so welcome everybody, and we're having a fab day so far. Thank you.
Brilliant. So what we'll do is start off with the first part of the presentation. And this is aimed at giving us some insight into what post-traumatic growth is and how we can all maybe consider the transition that we're currently going through at the moment and what we'd like to focus on, particularly linking into some of the shares that are within the FAB Academy. So I'm going to take the first part of this presentation, then we've got a pause where we can take some questions. Then Jules is going to take the second part, and then again we've got some pause for some questions and reflections if people have them. The aim of the first part of this session is to have a space really to consider transitioning, consider post-traumatic growth, and also the FAB sharing in terms of pandemic recovery. The presentation is going to look at your experience, hopefully feelings, look at change, learning, considering the future, and also all support available. And the reason I've put you is because of the fact that this is around all of us, but there will be some personal aspects that people may want to take away and use in terms of this presentation with the teams, and hopefully when considering sharing some of the things that we've thought about today, not only in terms of workforce, but in terms of patient development, in terms of system development, and in terms of working together. So initially, when we're thinking about post-traumatic growth, what I'm going to do is try and take us to our experience and your experience. And firstly, I think it's really important when we're thinking about growth to say a big thank you, because we all work in some aspects of health and social care, no matter whether we work in NHS, secondary care services, primary services, allied funded services, voluntary services or other. This pandemic has had a massive impact on us, and we need to start with a thank you, because of the first wave that we've been through has really tested us. It's tested how we work, it's tested our ability to be flexible and to change, and we've all been working at a time when we're under high stress, both in work but also at home. As Roy and Perrine just reflected, you know, we are people, we are all considering the risks that we undertake going out of the house every day, but also when we're at work there's that kind of added layer we've got around caring for others as well. So everybody's taken on a role at times of high stress, and we particularly work in health and social care have also thought of others, and what we know is that we're all champions and survivors of this first wave, and it's due to our skills and our actions and our attributes as well as we go forward. So to contextualise what we're talking about, post-traumatic growth does start with a recognition that we're all in a trauma at the moment, and this trauma is continuing. Moving on to feelings. So when we're thinking about post-traumatic growth, people will have different feelings about trauma. And some of these feelings are based in what we feel in our heart and what our emotions we experience, but some are around some of the things we're thinking about and having to plan about. Now, there's no right way of feeling. Down with a brain on one side and a heart on the other side. So why we're depicting this is because people's feelings will vary. Some people may feel quite invigorated by the challenge that they're facing. At times, some people might feel quite sad about their experiences. Some people, because of the programs of work they've been involved in and because of the achievements that they've seen, may feel really proud of their actions. Some people may have a lot of guilt, and when I've been working with teams around this, we've seen some guilt expressed from people who are maybe having to shield or homework, or maybe of different age categories, which mean that they haven't been able to undertake some of their frontline duties from before. And some people feel a bit confused about the restrictions upon them, around some of the advice that's given, which at times is changing. So the point of making the graphics that we've done around heart and mind is that we will at times feel mixed. Sometimes we will work in teams where our feelings may not be congruent with the other people that we're working with, but that's okay. That's because we're all in trauma, and it's okay to have mixed feelings, and we need to be really compassionate with ourselves in order for us to progress together, but also acknowledge each other. So the pandemic situation is quite unique. It's not something that within our lifetimes we will have seen before, although what we can do is draw upon other situations. And what I would say is that some people have said draw upon single episode traumas. And although there may be learning from things like the Hillsborough disaster, some of the Grenfell Tower, the Manchester bombings, these are single episode traumas where people have been able to go home. So in some ways, they're very different from what we're experiencing at the moment, because I think probably you'll all agree the pandemic is not something we can go home from. It is everywhere. It is all the time, and it is continuing at the moment for an undescribed period of time. And so this does make it uniquely different. And so although we can draw on potentially our experiences of managing trauma, for those of us who have worked in those sort of trauma responses, every day we might want to think about where we've been exposed to prolonged stress. And some people might not think of these as traumas, but we will all have experienced prolonged stress at times, whether that's something like prepping for examinations, prepping for big events like weddings, doing some training and then achieving something. The fact that we've been exposed to prolonged trauma means that we know we have to be careful around recovery and when we get to the end of some type of stress, because not only can our experiences and our emotions be different within the trauma itself and within the stress, but also our recovery and our response and our emotional response to this can also change. So for some people, progression will be quite simple, and people may be able to take the experience in their stride, may feel less affected by this, and then may be able to move forward. Some people can become unwell in the stressful period. And for some people, they will progress through the stressful trauma period, but when they get to the end or when there's a lull, there'll be like a letdown effect. And for this reason, we need to consider transitions because there will be different stages for different people. And we need to be compassionate about that, both for ourselves and our teams. Now I'm going to move on to the next slide. If you could see this, and probably good to bring into your minds, bring into your minds a river and two banks. Think of you can see a riverbank. You can see something that's entitled Bridges Transitions Model, and people may have used this in various different guises. Just to explain it, what this model does, it's very, very simple, but it recognises that when we move from one thing to another, we can think about it just as a change, like a switch going on and off. That's maybe a very simple way of thinking about change. Some of the better ways of thinking about change is to think about the transition, and therefore not just to think about the beginning and end point, but instead to think about the fact that we have a beginning, a middle, a kind of liminal phase where people will be experiencing different types of stress responses, will be developing different coping mechanisms, and will be also developing different things which can be really positive for moving forward practice change. So a reason that I present this when we're thinking about post-traumatic growth is that if we start on the bank where is pre-pandemic, what we've got to think about is the fact that we have a perception of reality that is based in a health delivery, a social care delivery that has the ability to meet face to face, that has the ability to interact with each other, and that is very much based on a relational and an interaction relationship that is not solely digital. We've then moved into the pandemic, and what we found out is a very digital world. So in this, we've made lots of different changes in this neutral zone, but it's not just around the change in the care delivery. We found ourselves needing to care for people in different ways. We found ourselves needing to work in different ways. And we see our new beginning in sight, which is the post-pandemic reality, but we need to get across the river. For some people, the river, extending this metaphor, will be nice and calm, and they will swim across that river. They will develop their services. They will see their post-pandemic recovery, and everything will be fine. But for others, there will be challenges. Their river will have rapids in it. Their river will have bumps in it. They may not be able to swim very well. So it's our responsibility in our journey to help others across to the new pandemic reality, to help others progress. And so the way we will do this is considering that when we start any transition, we will lose something. Okay, so all changes start with an ending, a loss, and letting go. The neutral zone is a position where we can learn, and the new beginning itself will be something that we can work towards, something that will be in some extent forced upon us, but that we can bring forward some of the things from our past. So for those who can see the PowerPoint slide, what I want us to consider is that notion of transition starting with an ending. So it's really important when you're post-traumatic growth to identify your loss. Now, this can be something individual, it can be something collective. So I'm going to go quite personal on this. Thinking about people's loss, it might be the loss of having a team to work with, or being in an office with people. It might be the loss of being able to see patients face to face. It may be a loss of a loved one in terms of bereavement. It may be a loss of seeing families and friends. We've got to accept that our current reality is quite different. And we've also got to accept that this loss can be subjective, and we've not got to compare or rationalise. So we've got to consider what parts of the loss are things that we can speak about and things that we can be sympathetic about, but acknowledge that actually some people may not be able to speak about the loss they're experiencing. Then we've got to think about the situation that we find ourselves in. So the situation that we find ourselves in, and what really is powerful about the Fab Academy, is that we've got people every day at different positions within organisations and also within wider health and social care provision, who have been really creative in terms of finding solutions, in terms of caring for each other. Now, this creativity, be it really small acts that have turned something really big. So people going out and clapping others in the pandemic, showing the appreciation. Sometimes that can really drive people forward to do their job, or think, do you know what, I'm going to take up a health career like that. Got to consider what we continue with. So for some services, we have stood down, we have changed the way we work, but for some services, they are working in a very similar way. We are seeing people face to face, and for those, their experience of the pandemic will be different. So for us as individuals, we need to think about what we will stop, but also what we will continue. And we also need to think about also, as we move forward, what the ending will be, what the ending will look like. Now, there's some parts of that which will be clear in our mind, but there's some which are uncertain. Who knows whether the second or third wave will come forward? But we've got to consider that. Now, the good thing about thinking about transitions in this way is that the river, or the neutral zone for those that can see it, will give us a potential and be a hotbed for innovation. What we know when we've looked at past traumas and we've looked at past experiences where people have been exposed to either prolonged or short-lived traumas, actually, out of adversity, lots of good things have been developed. And this is what post-traumatic growth is. So what we do in the neutral zone, in order to promote people being able to optimize this opportunity and chance, is to accept it will be anxiety provoking and it will be uncertain, both personally and professionally, but we also accept that it's a bridge between the old and the new. And we really encourage people to make use of this temporary system. Now, at times, it can be hard for us personally to make use of this system, but we can reach out to other platforms, be it the Fab Academy, be it some of the QI platforms that we see, to see what others are doing and see how we can adopt that and help our system move forward. So when we're considering what we are learning, so we're considering the growth here, what we need to think about is three things. So the first thing is, what should I and can I carry on with? Now, what I would encourage you to think about if you are going to use this type of model, thinking about post-traumatic growth either personally or with your teams, is that some of the things we can think about are things like, personally, can I still go out for a walk? Can I still exercise? Can I still carry on with some daily routine that both manages my own health, but also my personal stress? So we can think of this at a very personal level and also a team caring level. We can also think about this in terms of changing service planning. So some of us have started a journey, say, of digital care anyway. So it's using that platform we've got to then springboard forward. The second thing to think about is, what do I need to do differently? And this may need the help of others. It may also need the help of others that we haven't been able to connect with before. And we've got to think as wide as our teams, different organisations, then wider in terms of nationally and also internationally. And what's great about today is that we have people with international solutions that are happily sharing with us. So in this way, this is our liminal learning space too. So the third thing in terms of change and considering learning we need to think of is, what are the new things I may need to consider? So I'll give some examples again, moving back to the digital. So although some of the people I work with are totally tech savvy, and I'm not trying to stereotype, but certainly some of the younger people or the IT people I work with, brilliant, they come up with loads of new stuff. Well, I'm a bit slower than that, and I have some different disabilities. So I may need to consider somebody helping me a bit differently. And so when we're considering our personal change, but also our team changes, these three things to hold in our mind can be really, really useful, not only to consider what transitions and changes we make, but to consider how we best bring people forward with us. Again, moving back to the metaphor of the river, so we don't leave people drowning or lost in the rapids, that we're throwing them that life belt and we're helping them to move forward. And we're doing that in a compassionate way. So when we consider the impact of the change and also the learning, we've got to be honest with ourselves. We've got to be prepared to listen to other people. Some of our listening will be great, and it will be thinking about innovation. It will be with positive people. But what we know is that some of the things we listen to are going to be really difficult to hear. Some of the things are going to be people that are really finding themselves in a very traumatized state, that very sad, having lost colleagues, having lost friends, having really adjusted their situation at home. And unfortunately, what we also have seen is that impact on staff well-being, impact on staff mental health, and also impact in terms of suicide. So some of the things we may see can be traumatic to the system, but we can't close our eyes to it. We need to be prepared to hear and think about some of the negative things that have happened in the pandemic, which in turn we can try and use to be better. Our legacy as we exit this pandemic must be to be better than we were when we entered. And I do believe some of the things we've done around health and wellbeing for staff certainly has shone a light on potentially where previously we haven't invested as much as we could have done. So again, a post-pandemic legacy may be to have the best care for our staff, to give the best care to our patients that we can. So in terms of it, considering the impact of change and learning, we've got to also accept that it's a great time to stop, take and to consider alternatives. Now, for some people, they may have some time to do this, but for many people, and certainly just coming into this meeting from another meeting around second wave, it is difficult sometimes to make this time. But there is time to do some stop, take, and there is time to connect to systems. What we've got to do as we move forward is think about the new beginnings that we're working towards, because these in themselves, after the pandemic, will bring a sense of relief, stability, and also a future to build on. They will feel more secure than the neutral zone that we find ourselves in, or the river we find ourselves in at the moment. But when we move to that new riverbank, we're not just thinking about what we've changed. We're not also throwing the baby out with the bathwater. We've got to think about how we bring our old, our changed, and how we create the new. Because the challenge is, personally and professionally, to bring a structure and also to bring a way of working which builds on the potential. So when thinking about the future, we've thought about stress, we've thought about trauma, we've thought about how that can be contextualised, and we've thought about how we can pull on previous, be it maybe more low-level stresses, in order to contextualise what we're experiencing. We've thought about how this is very subjective, and it can also ebb and flow depending on the situation we find ourselves in, personally and professionally. So when we're thinking about our future, what we've got to think is about what our new experience or what our current experience looks like. We've got to approach it with a different mindset, where we acknowledge the stress we're under, but we also look for the innovation, we look for the creativity, and we've got to think about it being a different experience and a different way of working. So things like when we're working at home, we need to be quite forgiving if we see people's cats and dogs wandering around, or we hear things different happen, because actually that can give us a real creative sense of other people, and we bring maybe a more whole self when we're showing up at work. We've got to consider how we personally can be most helpful to ourselves, but also those around us. So I think the pandemic has brought a great deal of compassion from a lot of people. We've seen people supporting neighbours, volunteering, considering health careers, going and working in supermarkets, really becoming some of those key workers to help us get through this. We've seen some really good gestures to different parts of our society. We have seen some more negative things, but on the whole, what I would say is we've seen an incredible amount of kindness, and that we need to take forward, because it's both our kindness to ourselves and our forgiveness that we are experiencing a trauma, and so will respond differently at different times, but also kindness to each other that will help us most in terms of our post-traumatic growth. We've got an obligation to consider other people's experiences whilst also thinking of our own. And we need to personally notice our feelings, acknowledge them, and also take a breather when we need to. We've got to notice our needs as well as the needs of others. And we've also got to use our connections with people to think about this growth and this transition as we move forward. So this is how we're thinking about post-traumatic growth, how we're giving a model which people may want to hang kind of discussions around, may want to have personal reflections around, may want to reflect with teams and systems around, to think about this beginning, middle and end. And for the purpose of today and this presentation, particularly how there have been a number of contributions to the FAB resources and FAB shares, where people have been in the pandemic kind of liminal space. They have developed different ways of working, such as the wobble rooms, such as different ways of working with patients, such as different platforms. And in this way, this is how we will grow and move forward. These are the post-pandemic growth aspects that we need to focus on. So thank you to you all, and also for you all to take care of yourselves, but also hopefully this has given a little bit of thought around what post-traumatic growth is, how we can look at it in a framework, and then this will open up for the next phase of the presentation, which is what have some of the growth aspects been. So it's all right, can I take if there is any questions now?
Thank you so much, Dr. Jude. Yeah, if you want to type any questions into the chat box, I can help relay that, or
could I ask a question? It's Terry here. Jude, I hope you can hear me. Jude, I just wanted to say that was the most amazing podcast. Your voice is phenomenal. And yes, it'll be great if we can add slides to it for the video, but I learned so much just listening to you, your tone, your intonation. It was amazing. So thank you, Jude. I've really learned a lot. And it's made me reflect on myself, the team that I work with, and how we can best reflect and support each other moving forward to turn this adversity to advantage. So thank you, Jude.
Thank you, Terry.
I say yes, your voice and all your info was fab, regardless of the lack of video. Thank you. She loves the metaphor.
Thank you ever so much,
Leslie.
Okay, well, I'll try and not be traumatized by the fact that you guys couldn't see some of the metaphor, and I will take that very positive feedback. So thank you so much.
No, you didn't need it.
It's just to give you a little bit of history about before COVID. I went to Health Education West Midlands to ask, would they give us a little bit of money to help staff when they come back to work following a bereavement? And they very kindly gave me that small pot of money, and I was due to start that in March. So you can imagine, sadly, that had to be paused. But it was all around supporting staff back at work when they've had a bereavement. Because of COVID, it got me thinking that, you know, in my role as somebody that goes out and supports people at end of life and also does a lot of training for staff, that I visit every area in the whole hospital, so I could be one of those people that go out towards and offer support. I felt that staff would need to have debriefs, and I really wanted to support that. So straight away, myself and my team, we're very passionate about helping and supporting our staff, went out and did that support. So sadly, my bereavement staff support sort of needed to pause for a little while, but we turned the staff debriefs into action very quickly. And towards the end of my presentation, I'm going to tell you about some of the wonderful things that we brought in to help us during COVID. And because of COVID, we got things through much quicker than normal, and it was very refreshing. So we had a small donation because Roy Lilly asked me to help him with a booklet, and Jules Locke, my lead volunteer, around bereavement and COVID. And because of that, someone who's a good friend of the Academy donated some money, a very nice donation to the Swan Fund, which allowed us to, you know, really get some resources available for when we were going to really kick off with the staff bereavement and debrief service. So we sent posters round to all the wards, and we visited all the wards, and I'm still doing that now, and obviously I'm upping the support again. But the person that donated some money to the Swan Fund, it was around, sadly, a bereavement in the family, and her name was Joan Owen. And because of that lovely legacy we wanted to give Joan, her surname, Owen, worked really well with the things that we wanted to concentrate on. So we've used that. So for those of you that can see the slide, you can see that Owen represents openness, W, well-being, E for empathy, and N for new beginnings, which we felt was that recovery. And it went beautifully with our debriefs as well, because I developed the 3 R's, which is rest when you can, reflect, and recover. So it's all about realizing that our staff have been and are going through a really tough time, and actually supporting them. And it's okay not to be okay. And we've got the wobble rooms, and I know a lot of you will have heard talks about the wobble rooms today, and we have kept our wobble rooms, and they are really helpful spaces for us to go in, rest when we can, reflect and recover. And we've got these beautiful little cards as well. Next slide, please, Jude, for those that can see. That it's just stunning that it gives you the opportunity to write down things that help you. So whether that be a walk in the countryside, some time, you know, outside to reflect, visiting a nice place if you can, and go to the gym, you know, exercise helps a lot of people, walking the dog, things that you can jot down that help you. And then at the top of the card has got the 3 R's, and at the bottom has got openness, well-being, empathy, and new beginnings. And then on the right-hand side is the roses, Joan's favourite flowers. So it really is a legacy, and I'm hoping that, you know, yes, it's a SAF model, Owen, but I hope, like the Swan scheme that Fiona Murphy created, that we use here at SAF, but we call it something slightly different. We call it the Swan scheme, actually. She calls it the Swan bereavement model. But we would hope that people would like to share this and use them in their own organisations. And it's all about that Academy of Fab stuff, that, you know, we share the fab stuff and, you know, absolutely pinch with pride. And, you know, if you want to change it to something more suited to your area of work, then absolutely. But the idea is that staff are our best resource. And if we look after our staff, you know, we just have everything, don't we? But if we don't look after our staff and our staff go, we have nothing. And our staff are absolutely key to, you know, we have seen people go above and beyond during this time and moved out of their own homes so that their you know, family is safe. And it's so important that we look after our staff. And if you look after your staff, they will look after our patients, and that is absolutely key. I have a very supportive team, and I hope that we have shown that we've been visible leaders. We've gone out, we've seen staff, we've done, you know, wellbeing checks. We're not counsellors, we're not trained counsellors, but we're there and we're listening. And that's what people want very often, is that opportunity to be heard. And I'm a peer-to-peer volunteer as well, which I wear a badge with P2P on. And it's all about that support and that listening. People just need to be heard, have an opportunity to speak out. And then as a peer-to-peer volunteer, I will signpost people, maybe to the Speak Up Guardians, maybe to counselling. Our hospital have put on some special counselling service for staff during COVID, and it's COVID related counselling that they will help and support with. And I'm sure you've got, your areas have done, you know, similar things, and there's been lots of signposting to support that we've been sharing. Also, as part of the staff bereavement support, I really want to try, when we're allowed to do some more face-to-face teaching, is to actually educate our staff on how to support somebody coming back in their team that has had a bereavement. And I just want to read out some of these myths that some of you who have had, sadly, a bereavement will understand. So these myths are: don't feel sad, replace the loss. So if somebody has died, someone might say to somebody who's lost a husband, you know, you'll find someone else. It's just not helpful language to use at this time. Grieve alone. Time is a healer. It's not. If you broke your leg today, you would go to the doctors, you would go to A&E, you would get some treatment. When you break your heart, it's the same. We need help and support. So time alone does not heal. Be strong, keep busy. These are the things people do. They think it helps, but when they do have time to, you know, slow down and pause, that's when these feelings, you know, come to the forefront. And we really should encourage people to take time out and talk and sharing. It really does help and support people. What to say? You know, what's happened? Can you tell me a little bit about it? I can't imagine how painful, devastating, heartbreaking that must have been for you. And what never to say is, I know how you feel, because you really don't, because your bereavement is your own individual bereavement, and it's individual to you. And even if, you know, your mum died and their mum died, it's totally different. You have a different relationship with your mum to theirs. So it really is important that we don't say, I know how you feel, because we really don't. Everything will be okay again. And, you know, reinforcing that, you know, if somebody, for example, a dog dies, getting another dog is not going to replace that beautiful pet that you had. So it really isn't helpful. And anything that is about you, you know, if somebody has taken the courage to ask for help and they say, I want to talk to you about my loved one who died last year, the worst thing you can do is say, oh, it happened to me, and yes, isn't it awful? Because straight away then they'll probably, the barriers will come up and they will stop talking, because they'll want to go and find somebody that really will listen to them and talk about their loved one, because I've never met anybody that doesn't want to talk about their loved one. you know, and that's, and actually call them by name. The language we use in end-of-life care and care after death is so important. So visit, not view, important conversations, not difficult, you know, person, not body. So important. I can't express how important it is. There is some great resources out there. The Grief Recovery Handbook by John James and Russell Friedman. And there's lots more books and signposts in the Grief Project. There's lots and lots. I think it's the Good Grief Project is really helpful website. I put a lot on Twitter about end of life and bereavement. And, you know, it's really, really important that we help and support people through this. We will be doing some evaluation on our staff bereavement support. We absolutely will be. And I've got the questionnaire in front of me, and it's about asking people, how did you find out about the service? How many sessions have you had? Did you find the bereavement support service helpful? Would you recommend the bereavement service to other staff? Will you be seeking other support? So that's around signposting. And obviously, please add any comments that you wish. So that's really about our staff debrief and bereavement support. And the debriefs have been so important to teams. Some people have had one-to-one, sometimes people have had team debriefs, but they really have helped staff. And I went on to a ward the other day and they said, oh, I wonder who you come to see, Jules. I can't think of an end-of-life care patient that you may have come to see today. And I said, I haven't come to see any patient in particular. I've come to see you. I've come to see how you are. And they were so grateful because they're a COVID ward, and I go in there regularly and see how they're feeling and put things in their staff room, you know, little posters about new things, little goodies. My lead volunteer has been baking and we've been putting cakes in, and it's all about that staff support. So Jude, if you could go to my next slide, I'm hoping that will be the memory stones on, if that's correct. And we have placed in 2 gardens, one at Shrewsbury and one at Telford Hospital. We have placed a stone for every patient that has sadly died from COVID-19. And these stones have been beautifully painted and donated by the community. So we, as a team, place them every month, and staff are spending time in the gardens and looking at the gardens. And there's a lovely bench in one of the gardens, and they sit and reflect. And I did a radio interview from the garden one day, which was beautiful to be able to tell our local community about what we're doing in the hospital, because so many people in the community, as Jude said, want to help. They want to support by crocheting, knitting, little hearts that we've been gifting. All these things have been absolute key. So, and then the next slide is some innovations really that obviously at end of life, we have always allowed end of life care relatives to come and visit their loved one at end of life. Obviously, with aerosol generation procedures, it's been more difficult in ITU areas. We weren't able to do this initially, but now we have moved on to try and get fit mass testing for these relatives and help and support as many as we possibly can. It's not always possible, and obviously if people have got symptoms themselves, they cannot come in to visit. So we've done a lot of virtual visits, and I know nationally people have been doing these virtual visits and they've been amazing. But we need to carry on with these, because especially where I work in a rural county, there are relatives that can't come in and see their loved ones. So by being able to have iPads and iPhones, it has really made a difference. And what a privilege for some of our nurses to be able to facilitate those conversations. I've done many, and it's been absolutely, you know, so emotional, but an absolute privilege to support these families at the hardest of times. Obviously, we've not stopped visiting, but we have restricted it. And we even set up an end-of-life care ward in our hospital so that it was in a different part of the hospital to reduce the risk of people, you know, coming in. And obviously they weren't so scared of coming into a separate part of the building and not in the hospital. And supporting people with wearing PPE, and us wearing a photograph of ourselves on our PPE so that they can see the smile, the face behind the mask. But the pass for end-of-life care visitors is something that the relatives can hold up, because obviously security are around at the moment, and they are questioning people coming into the hospital at times, so they can show their pass, and that gives them the permission to visit their loved one at end of life. And the pet passport as well has been used throughout COVID. We've had a few dogs and cats in. We risk assess it, obviously, and all our taste for pleasure work has really carried on during COVID. So important. And for those of you that can see the slides, there's also the little hearts. The heart is one of two. One is for your loved one, the other is with you, made with tender loving care. So we place one heart with the patient, and then when they have died, that goes with them to the Swan bereavement suite, and the other one, identical heart, goes to the family. And if they're not able to come in and they've not been able to visit, we've got lovely little cards that we can send them, and we've even got little flat hearts that we can post out into the post. But these hearts are beautiful, and they have been done by the community, and it's just been overwhelming, really, the support we've had from the community. It really has. So I think, Jude, that's all my slides. Is that correct? If you want to come back in, I just wanted to say about the clapping that Jude mentioned earlier. The clapping, I loved it. I absolutely loved it. But I have to say that some of my colleagues didn't like it at all. They felt embarrassed by it. They felt they were just doing their job. I thought it was something lovely for the community. It was something that they were able to do, and I really liked it and look forward to it. However, it's just to be, just to acknowledge that not everybody felt the same. So, we have different opinions about the clapping, but I know we've got a slide with fabulous Captain Tom, and I've certainly put in a bid and been successful to have some of that money to carry on some of this fabulous work. So I'll pass this back over to Jude, if that's okay, to sum up. And if there's any questions at all, I'd be happy to answer those. Thank you so much. And today's just about a celebration of all the fab stuff. And keep on doing the fab stuff and sharing it. Thank you.
Thank you ever so much, Jules. So what we've got for the people who can see is just a question slide for Jules, because we're just going to pause a second again before we go into a conclusion and some other reflections if there isn't a lot of questions. So I don't know whether there is any questions at this stage around either the memory stones, the big little things, the end of life pass, the 3 R's, or the Owen.
If anyone does have any questions, they can either just unmute themselves briefly, or you can pop it in the chat and I can ask for you. No, everyone's just in awe of everything you're saying. It was absolutely gorgeous. Really lovely to listen to, and it was such great stuff you've been doing. Really.
Oh, thank you. And we'll keep working hard. Absolutely. Thank you so much. Day to celebrate, I think, today.
Absolutely. So if you want, did you say you've got one last little slide? And if anyone else has anything else they'd like to add, or just a comment, just pop it in the chat and we can get to that as well.
Yeah, just to say to Jude, really, that I love the slide she's put up at the end for those that can see it, the clapping. Microsoft Teams has been amazing. I love it. And, it's about not going back, isn't it? It's about, some of these things that we've been doing during COVID to absolutely stick with them. I don't really want to be traveling off site if I can help it, to save us time. If we can log on to a Microsoft Teams meeting to save us going, 30 minutes down the road, that's a really good use of our time. I do miss people. I do miss sitting in a room with people. But some of the stuff that we've done, especially around, the digital stuff, I think we really do need to keep going. And Captain Tom has been an absolute inspiration. So that's been fabulous. So, Jude, what do you think?
For the conclusion slide, what we've done is put together something that looks like a ripple, so a drop in a river and a ripple forward. And what that is to do is to represent how what we can do is learn from each other. What we can do is make a difference. And like we've seen with the wobble rooms and other things like we've seen in the past pre-pandemic, such as the Hello, My Name Is. Small things sometimes make a big difference and also trigger people to think about other bits about well-being for patients, carers, and staff. So really to bring this to a close, but also to share a couple of other bits. What we wanted to do was, if we had time, which we do have kind of 15-20 minutes, we won't take all that time because I'm sure that people do want a little break. But what we thought is we would offer up just a couple of things that also have really started to shift in terms of the pandemic. And so for those who can see the slide, and you can see a selection of pictures. For those who can't see the slide, I'm just going to describe what the pictures are, and then I'm just going to go through them one by one in order to just share some of the post-pandemic growth that we've seen with Jules, and then so that they can kind of be sprinkled out, hopefully, like confetti, and then people can maybe use these if they haven't already done that. So on the slide, there is 5 pictures. One is for Tom and his actions to selflessly contribute a lot of money to the NHS, which then has been put into staff and patient wellbeing. And we wanted to share this partly for what Jules has said, but partly to say that there are often pots of money that people aren't aware of, and so even though we are at times financially stretched, we may want to think about using these different pots of money or reaching out and having some donations in order to take some of our different interventions forward. Sometimes we only need a very small amount of investment to do quite a lot of things, and Jules has shown some of those examples. So Colonel Tom was one of the first pictures. The second picture is a picture of Zoom. So I'm sure we've all used Zoom, Microsoft Teams, or any other platform that people are using. I know some people use WhatsApp and other things. What we know is our digital acceleration within the pandemic has been huge, and it is no doubt that this is an aspect of pandemic growth that will make our services much more accessible. So because we've got a little bit of time, I just wanted to share with you a couple of points of learning when I've been reflecting with my teams that contribute to pandemic growth when considering digital engagement of patients. So I've been doing some work with particularly therapists of different kinds, AHPs and nurses, around how they deliver and interact with patients using online forums differently. And I've asked them what the feedback has been from people. So at this stage, there is some anecdotal feedback. Some of it we are gathering evidence, and we have got some research studies going on. But in terms of equality of access, it's had huge advantages. And just sticking with equality and diversity, some of the examples of the advantages that we've seen. In our neuro rehab services, we've had people talk to us about sometimes the discomfort of having to come and sit in very clinical environments, leaving their own home where they have specially adapted furniture, they have different things that's accessible. The discomfort of having to book transport, the nervousness about whether that comes or not, and also having to have carers with them. That hasn't had to be when people have been able to engage digitally. And people have said that they may not always have been the first people that they thought of to do a digital engagement with, but actually it's meant that they're less fatigued, it has less impact on their day, and they felt much more able to engage and had to cancel less in terms of their appointment. Other examples are, we've seen our people with different communication impairments who have said sometimes it's difficult when you're in an interaction and you're talking to people and you maybe don't hear them properly, or they've got an accent, or maybe it's hard, or you feel uncomfortable about questioning people. What they've said is the digital encounter, specifically the use of certain platforms which enable us to turn on the subtitles or turn on the narrative aspects or the whiteboard aspects, have enabled a communication that they haven't had before. We've had a much better uptake of people using translators. Now we've been doing some of our work digitally. And then a third point to make in terms of some of the post-traumatic growth, I work a lot with improving access to psychological therapies in the IAPs, so some of the primary care. And I've been asking what has been the changes you've seen. Now, they've started to see a real shift in some of our hard to reach groups in terms of how they previously took IAPT services. So one of the groups they've seen a switch in is men accessing groups. What they've said is that when they've surveyed people before, and we have seen men as a collective group who haven't always uptaken some of the group work and some of the one-to-one work, we've asked why, and some now who are uptaking said there's a bit of a shame in being face to face. There's a bit of a anonymity which can come with digital, because it's often much shorter than having to travel to a place, engage in an intervention, and then leave and then travel somewhere else. It's had a lesser impact on their day. So what we have seen is some massive reflections around how our switch has had a big impact in terms of accessing communities who have got health inequalities and who need to work differently. Switching that to some things which are maybe not so good, which we've needed to also think about. What we've seen in terms of digital delivery is that people's homes previously was much more of their safe space. And with some of the services I work with, safeguarding issues, support for complex trauma, and support for trauma that has sometimes happened in the house can mean that when therapists or professionals are delivering from their home environment, it changes the safety of that home. So we've needed to risk assess the environment, people working differently. And that's helped us think differently in terms of our post-traumatic growth. And then, because I don't just want to end on a sad note for that, so to bring something else that's really good in terms of this digital aspect. What we have seen is our staff engage differently. So we've set up shielding conversations for those people that have been working from home and have really wanted to contribute in the pandemic, but for different reasons, often because of their diverse characteristics or makeup, they haven't been able to come in. And they have talked about their disability differently. They've talked about their long-term conditions differently. They've also talked about how sometimes the system doesn't see them as a valid part, whereas actually some of the roles they've undertaken in the pandemic has increased what they feel has been their validity. So to hear that voice, to hear the voice of staff with disabilities, staff who have had different impairments, and the opportunities that the pandemic has afforded us to be flexible has been really good. And we've tried to be creative around that. So one of the things that we're trying at the moment is a clinic space for people who may be digitally disadvantaged. So they may not have the kit at home, they may not be au fait with using Teams or other things. But what we've set up is clinics where they can come and access iPads or other pieces of kit, so they can then still work with their worker who is maybe having to isolate at home because of the fact that they are vulnerable for whatever reason. So I suppose it's both switching that round, because these digital innovations aren't just very protective and have lots of advantages for our people, our patients, but also for our staff wellbeing as well. And this is a post-pandemic growth aspect that really has helped us, because sometimes people who don't have that access would go off sick, would maybe not be able to be as productive as they would or can be now. So we wanted to bring in the some reflections around post-pandemic growth in terms of what we're seeing digitally at the moment. So I don't know whether you want to add anything to that, Jules.
Just wanted to say really that, as you say, you know, it's been a lot of things that we've done have been really refreshing, that we've got things through very quickly, you know, safe operation procedures we've got through really quickly, and they've happened. You know, we were going to try and do virtual visits some time ago, and it was you know, taking us time to get round to doing it. COVID just made sure that happened instantly. So, you know, I'm just really keen that we don't go back to old ways, and we keep using these brilliant ideas and, you know, keep sharing on the Academy of Fab stuff. I know that we're both very active on there, and I've certainly shared the staff bereavement and debrief work and the visitors pass. So look on the Academy of Fab stuff, you know, pinch with pride, and we will continue to be very active on there, and thank you all so much, and I hope you continue to listen to the conference in and out today. I'm going back to run the event this afternoon, but it's been great doing this jointly with you, Jude. Thanks ever so much.